Welcome back to CDM. We are honored to have with us Dr. Peter McCullough of the McCullough Foundation and the Wellness Company. He's been one of the primary voices against the medical tyranny over the last few years. Doc, thanks for coming on. I really appreciate it.
Thanks for having me.
So, Bill, you've been doing a lot of the work on this bird flu issue. I want to turn it over to you because you have a lot of questions which I think you need to ask. So go ahead.
Well, thank you, Todd, and thank you, Doctor, for being with us today. One of your key team members, Nick Culture, has been very gracious with his time in the past weeks to keep us up to speed with the bird flu, especially following California's surprising declaration of an emergency regarding the bird flu. And now comes, widespread reporting of one apparently severe case. And so we find it's a very important time, perhaps not very advantageous in terms of the new year, but important, I think, to make sure that folks have facts on what this appears to be, where it may have come from, what can be done to mitigate risk, and what folks should expect and perhaps not expect as we go forward. So let me start with, we've been talking about this for some number of months now. And it kind of stems from the fact that many of the global organizations have almost been foreshadowing this. But what's your impression? Is this doesn't seem to be much of a surprise, does it?
It's not. In a review article by Lysette and colleagues, bird flu has been around at least 100 years. And it comes in waves through flocks of chickens all over the world. And then they get natural immunity. The Chinese and Southeast Asian countries started vaccinating poultry about 20 years ago, and it backfired. So actually now is spread, made it a bigger problem. I think that's been a setback. Our current outbreak of bird flu, or H5N1 highly pathogenic avian influenza, that current outbreak is now 4 years old. It's going to start its 5th year. And it looks like the origins of this are the USDA Poultry Research Laboratory in Athens, Georgia.
Well, that hits home for us because we sit here right in Georgia, about 50 miles from where you're describing. In the past few days, you've indicated a pretty high degree of confidence that this version, clade, I think you refer to it, is associated with that. How do you come to that conclusion?
Well, the USDA was doing its research in abstracts and publications. We simply tracked them down. They were doing serial passage in mallard ducks. It's particularly dangerous research, not because it's harmful to the ducks. The ducks can carry the bird flu virus without getting sick really at all. But what happens is the mallard ducks are wild. They tend to escape. They're not like chickens. Mallard ducks can fly all over the place. And as this map points out, we started to see spread coming out of Athens, Georgia, of this clade 23446B. And that is, the origin source. This is called gain of function research because it's serial passage. They keep taking different strains until finally a mallard duck can accept the virus and then spread it to another duck. And sure enough, the ducks must have gotten out because we saw the very first animal cases right around Athens, Georgia, both in migratory waterfowl, but also in sea mammals. This was important. Now, 16 states have outbreaks. The mallard ducks have carried this bird flu to farms. We've seen poultry farms, dairy farms. And instead of acknowledging that it's being spread by mallard ducks and continually reinfecting the farms, we've seen draconian measures. You just can't believe this. Sid Miller in Texas, the ag director, he directed a Cal-Maine, a big egg manufacturer in West Texas, to cull or intentionally kill millions of perfectly healthy chicken. We've seen the same in Colorado as well as Michigan. Now it's going to happen in California. They are ignoring the fact that it's a useless strategy because the mallard ducks are going to continue to reinfect the farms. And it's pretty mild, by the way, in both the mallard ducks, the cattle, and the chicken. I attended the University of Arkansas Bird Flu Summit meeting, and there they disclosed there's only been about 10,000 chickens they believe who have died of this bird flu, 10,000, yet millions, probably over 10 million healthy chickens have intentionally been killed as part of a biosecurity strategy.
Maybe there's another agenda there.
In a previous conversation with again your associate Nick Ulcher, one of the things we explored was the fact that if those birds had been allowed to live and work their way through the disease, many of them likely would have attained immunity, which then could have been passed on in the natural world, as has been happening for millions of years through various populations. And it seems to be this culling seems to be literally the absolute wrong thing to do, because it doesn't allow that immunity to be developed in a population.
Well, that's right. So the animals get natural immunity. If we just let them alone, they would get natural immunity. The culling not only prevents natural immunity from settling in the population, but in fact, it spreads the virus to humans. So most of the cases where it's gotten in the eyes and caused conjunctivitis in the farm workers, there's been the poor workers who have been assigned to kill all the chickens. And some of the dander comes up and they actually have contracted SARS-CoV-2 from culling. This happened in Colorado, for instance. So culling, we should be immediately stopped. We should not quarantine the cattle. Currently, Gavin Newsom in California has got 47% of dairy farms has the cattle quarantined. And now we have Deborah Birx, former White House coronavirus task force member, coming out on national TV, Meet the Nation and CNN. And she said we should be doing PCR testing weekly of the animals and the workers. And you know what that means? That's going to raise even more and more false positive results.
Pardon me for just a minute.
So, do you think that the false positives are an agenda possibly to spread fear? What do you think? I mean, if they're what are these measures attempting to do you think?
Excessive testing, which is what we saw in the COVID-19 outbreak and now with the bird flu scare. Excessive testing will raise alarm bells to push decision makers into population mass vaccination. And that's exactly what we're seeing. Emory infectious disease Dr. Leanna Wen came out on CNN, as the other news shows, and was pushing the Biden administration to rush, approve, and distribute a bird flu vaccine. We have a 2021 bird flu vaccine by a company called CSL Seqirus. It's an antigen-based vaccine. It looks particularly dangerous. In their FDA dossier, normal human volunteers have died due to this vaccine. It's not worth it. I can tell you, it's not worth it for any farm worker or dairy worker to take a bird flu vaccine. Yet the European Commission has purchased millions of doses, and even in Finland, they've actually started to human vaccinate the workers.
Wow.
If I didn't misunderstand, I believe that there was a publication that indicated that the incidence of serious adverse effects, including death, was, I think, 5 times greater in folks that took the vaccination than those who took placebo. Is that possible?
That's true. It's in the CSL Seqirus package insert. So if you go to the McCullough Foundation Twitter feed, we've got it there for you. You can just look at it yourself. We should never have normal human volunteers ever die in a vaccine trial. And to see 10 deaths with this bird flu vaccine is terrible. Can you imagine what the families are thinking right now? As a medical doctor, I do not advise anyone take a bird flu vaccine. The CSL Seqirus one, the one that's ready to go, is not safe. And I'm greatly concerned about Moderna's messenger RNA bird flu vaccine that the Biden administration is invested in. And then the Gates Foundation, CEPI, Coalition for Epidemic Preparedness and Innovation, their bird flu vaccine is a self-replicating messenger RNA vaccine. These platforms are not safe. They're going to massively load the body with the hemagglutinates, which is the spike protein for influenza. And for a very benign infection, we've only had 65 cases in the United States. It's basically like a case of conjunctivitis. We could potentially seriously injure many more, or some may die with vaccination.
Doc, what about, has anybody in your foundation or team contacted Athens and said, can you tell us what you're doing or what's going on or why are you doing this? Any questions been asked? Any response?
The McCullough Foundation, John Leake and Nick Hulsher, epidemiologist from University of Michigan, they attended the bird flu summit in Washington, D.C. And that was put on by a government contracted biosecurity firm called Ginkgo Biosecurity. And one of the questions that John Leake asked, and he was on camera, is he said, what biosecurity measures do we have in place if bird flu came out of a lab? And the person at the podium from Ginkgo had no answer. She was caught totally flat-footed. This got out on Twitter and it went viral.
Wow.
And people were tweeting. And you know what? Ginkgo contacted us and said, please take down that tweet. We didn't give you consent to film us. So let me tell you what, Nick Hulsher, myself, John Leake, we've published the proximal origins paper on the source of this clade being the Athens, Georgia USDA Poultry Research Laboratory. It has not been denied or challenged by any credible USDA or public health official.
You would think that Governor Kemp would be like, wow, this is a big deal. We should look into this. Let's talk to Dr. McCullough and his team and find out what he's found out, but nothing, I guess.
Well, I think as your research has shown that it's big money coming to Georgia, big academic money coming for more and more poultry research.
Yeah. Yep. This happens to be the announcement of when they opened one of the facilities in use for this research, and they made a big deal out of it. There's some of our politicians taking a victory lap on opening the facility a couple of years ago. So I think you're exactly right, Doctor. You mentioned the severity for the vast majority of cases is quite mild. Yet they seem the reports on it seem to focus on the single case, as I understand it, as of just before our taping, single case of severe illness. Yet they don't talk about some of the details. They don't talk about the person's age. They haven't discussed any comorbidities that may exist or other types of conditions. But they do focus on the person is considered severe and is hospitalized. Do you have any other read on that you could share? Because I want to make sure people understand that, as you say, the vast majority of cases are quite mild.
Right. The current outbreak, majority 65 cases, the majority are just conjunctivitis or pink eye. There's one serious case in Canada of a 17-year-old girl who had respiratory symptoms, and then the 65-year-old man in Louisiana. Now, it's reported that he had dead birds in his backyard, may have handled them. He's over 65. He is said to have medical problems. He's in the hospital, and there's no signs of him worsening. So I anticipate, he's going to be fine. He's going to survive. But the details is that this man had the D1.1 strain, that the virus mutated. And that's not the strain that the dead birds had. This is very important. So this bird flu now is showing mutational capabilities. In a sense, this may have jumped into him and caused a severe illness. Now, Deborah Birx was out on CNN, Meet the Nation, and she mentioned the issue of what's called co-infection, where there is human influenza and bird flu in the same person, and then those two influenza strains swap genetic material and potentially become more lethal. So this co-infection, this reassortment that can happen, that's been shown in the test tube. And I think it makes the strongest case to use nasal sprays and gargles twice a day, because an iodine-based nasal spray like Immune Mist that we feature at the Wellness Company, it will kill both strains, both the human influenza as well as bird flu. So instead of letting the viruses mix and potentially cause a more serious strain, let's knock it out early and preventively with Immune Mist nasal sprays and gargles.
Okay. And that would perfectly brings us to the next point, which is if folks are concerned about being exposed to this, they can take certain measures to minimize potential exposure. and perhaps pre-treat or pre-protect themselves to some extent. You mentioned something that I happen to have a slide on here. Let me bring this up. So one of the things, and this is part of something that's offered from your concern, the wellness company. Take us through these preparations, if you would, please, Doctor, just briefly.
If I was running a dairy farm or a poultry chicken farm or a poultry factory, I would outfit every worker with what's shown on this slide. That is immune mist, nasal spray, and throat spray, and then a contagion kit from the wellness company. Now, the immune mist is a iodine-based solution with normal saline. It's very well tolerated. It will effectively kill any of the virus that we happen to breathe into our nose or have in our mouth. Should do it twice a day. 2 squirts, sniff it back, spit it out, spray and gargle with iodine-based spray. You can additionally use scope or Listerine. That's fine. Now, the contagion kit contains in it oseltamivir, which is a first-line anti-influenza, antiviral. I would start that immediately on day 1. Hydroxychloroquine additionally has antiviral capability. Any difficulty breathing, we can use budesonide, azithromycin to cover secondary bacterial infections. If this man in Louisiana would have had the nasal spray and gargle and the contagion kit, I can tell you he never would have ended up in the hospital. So hospitalizations can be completely avoided. You know, we've never had a human bird flu death in the United States. The deaths that have occurred have always been in Southeast Asia, very poor nutrition, Asian families sleeping with the chickens, massive exposure, no healthcare, presenting very late. A series of these deaths were written up in the New England Journal of Medicine in 2005, and I reviewed all of them. I think all of them would have been saved with modern American medicine. And clearly in today's age, we can probably prevent human bird flu. And if anybody does get a case, we can knock it out early, completely avoid hospitalization and death. These are the practical solutions we're offering on CDM and with the wellness company that we're not hearing on mainstream media from Deborah Birx, Leanne Wen, or the commentary, the commentators on mainstream media. They simply are stoking fear and trying to rush vaccine development, but not giving workers things they can do right now to practically protect themselves. And that's what we're in the business with doing at the wellness company.
I happen to have one of those right here. And the beauty is that you have it in your home or your car or you're traveling. And if you get sick, you can get online with the wellness company docs for free. And they'll tell you how to use this and what to use when and all of that. So it's really a fascinating system.
There's another advantage to that too, and that that strikes me, and that is in the middle of the COVID concerns, some preparations that would have been easy and now in the fullness of time, we recognize they could have been effective. Hydroxychloroquine, ivermectin, and other things were very difficult to come by, and having that kit available, make sure that that's not the case this time. The preparations are available.
You're so right. So these are pre-prescribed, so people have them. They last for years. The kits are very handy. I'm traveling in Colorado right now. I've got 2 kits with me. I've already had to use one. I've had to use the red emergency kit because someone had an injury, and we avoided having to go to ER or urgent care with that. Remember that let's say one does get influenza and they use the oseltamivir and they use the azithromycin, for example. Wellness company, we control our own pharmacy lines and our own drug supplies. And so you simply can get online and get a refill. So keep your emergency kit well stocked. This saves people having to go to urgent cares or ERs, which are far more expensive than having the kit and having the peace of mind that with the guidebook and telemedicine backup, that Americans and people all over the world, they can handle problems themselves and keep themselves out of harm's way in this new era of pandemic threats.
It's really re-engineering healthcare. What do you got? Anything else, Bill?
I had one more question, or part observation, part question. As I understand it, we've talked throughout this discussion about infection based on exposure to animals of one type in one situation or another. There, as I understand it, there has been no example or no proven example of human to human transmission of bird flu. Is that still the case?
That's still the case. No human to human transmission, but I think we're just very close to that right now because the virus, as the Louisiana case indicates, is mutating. And if we get to human spread, it's going to up the ante for everyone to take preventive measures at this point in time. Don't rely on a vaccine. Remember, influenza vaccines are very poorly effective. Most years, the influenza vaccine has essentially statistically insignificant effect compared to zero.
Yeah.
So influenza vaccines do not spare people getting influenza. They don't make it milder, and they've never reduced the risk of mortality.
But they make a lot of money for the pharma companies, Doc.
Our public health officials have a love affair with vaccines right now, and they have, in a sense, in their minds, the only thing they can think of is vaccination because there's so much money behind it. You know, the vaccine industry is a $78 billion industry per year. And so every drug company wants to be in the vaccine business. And, I think people who take the vaccine and still get influenza, they're miserable. They'd much rather, if they take the shot or don't take a shot, much rather have a nasal spray, a throat spray, a gargle, and a contagion kit ready to go, because that's what makes the difference and helps people get through the illness.
Yep. I know there's many people hoping that with the changes that are anticipated coming with the Trump administration in after the 20th, and hopefully quickly after the 20th of January, that it's perhaps in some people's mind, no surprise that we're entering a time where folks could try to implement more controls, more things prior to that. And so I think the more information folks have, the better off they're going to be. We again thank you very much. Your work, Nick Culture's work, the foundation's work, everybody involved. And we will continue to stay on this so that the right information can reach the folks as fast as possible.
Thanks, Bill. Thanks, Todd. Yeah. Happy New Year to Paul.
Happy New Year. Enjoy the skiing.
Happy New Year to you.
Take care.
Okay. Bye-bye.